Thank you, everyone, for joining us this evening on the unceded, ancestral, and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, who have stewarded this land since time immemorial. My name is Tracy Saxby. I am a marine scientist, and I am the executive director of My Sea to Sky. I am a recent settler to these lands. I first visited Squamish in 2001, and I am immensely grateful every single day that I get to live in one of the most beautiful places that I've ever seen in the world. I've now lived in Canada for 25 years. This is my heart's home. As I've stood beside Indigenous land defenders these last 12 years since I co-founded My Sea to Sky with the wonderful Owen Finn there and 4 other wonderful, amazing people, I've been on a journey of learning about the ongoing genocide that continues to this day in Australia and in Canada to enable resource extraction that pollutes the land, the water, and the air we breathe. I'd like to invite all of you to take a few deep breaths with me. In, out. In, out. In, out. Most of the time, breathing is something that we do without even thinking about it. We live and we breathe on these lands. But what is in the air that we breathe? Is it clean and healthy? Is it polluted? What can we do about it? These are some of the questions that we're here to talk about tonight. I encourage you all to listen with an open heart and an open mind, as you may hear perspectives that are different from your own. I ask that everyone be respectful as we listen to the Indigenous land defenders and the healthcare professionals that have travelled from across BC to join us this evening. So to introduce our first speaker, Dr. Tim Takaro is a physician scientist at SFU. He's Professor Emeritus in the Faculty of Health Sciences and Planetary Health Lead in the New School of Medicine. He's an active member of the Canadian Association of Physicians for the Environment. He's father to Annie and Ben and life partner to Aggie, living in gratitude on Quaquet unceded lands. His career began at the University of Washington in occupational and environmental medicine, where he researched the links between human exposures and disease and finding effective public health-based preventive solutions to such risks. His current research program explores the impacts of resource extraction on human health in relationship with our land and waters. With immense gratitude to the First Peoples, he is beginning to use Indigenous knowledge to relearn environmental health as he tests different interventions in climate action and planet protection. And with that, I'm going to hand it over to Tim.
Thank you very much, Tracy. It's a pleasure to be here with you tonight. I just want to introduce the Canadian Association of Physicians for the Environment. We're very privileged to be here with former President Melissa Lem and to have worked over the years with land defenders such as we see here with Ms. Houston, who is really a bulwark of activism in the North. We are a physicians group that welcomes all health professionals, and we advocate and educate on issues related to the environment. You can see here Dr. Ulrike Meyer with, in the background, Melissa and Chief Stuart Phillip at one of our LNG events where we rolled out our strategy for stopping the deadly practices that are going on. I think it's no news to you that fracking and LNG are harmful to our health. It's harmful to our health system and significantly impacts Indigenous communities and rural communities and generally marginalized communities. There is one exception that we'll talk about today, and that is the Tilbury LNG plant, which sits right in the middle of the Fraser River between Richmond and Vancouver. First, put this in context, because in today's political climate, we tend to forget that we still have a climate emergency. This is the Coldstream wildfire in 2022. I'll just note that last year, Coldstream had another wildfire and another evacuation. And it is this that is driving those disasters and fires. This is global temperature change from the beginning of the industrial age in 1850 to the present. And what you see are changes in color from an average temperature in 1960, so that everything in blue is cooler than that average, and everything in red is warmer. And you can see, as we get to the present day, it is getting hotter and hotter. And it's being driven by this curve, which is CO2. When the industrial age began, 285 ppm, 131. And here I'm going to out myself. I was born at 313. So we know that climate change is negatively affecting health. This was a report that I helped author in 2022, The Health of Canadians in a Changing Climate. What is different about the future is in our hands. We either have a future where we start bending the curve down and avoid temperatures above 2 degrees, or we have a future where we keep doing what we're doing today, which is increasing the CO2, increasing the temperatures, and increasing the death and destruction. Many of you have felt these impacts already. How many of you were here during the heat dome in 2021? Horrific, right? And we're in New Westminster, you had a high risk of dying. There are other impacts: crop damage, reduced tourism, dangerous working conditions, the increased social disparities driven by climate change, and most concerning to me, I think, is a reduction in the supply of fresh water for agriculture and drinking. 2023 wildfire season alone, this is 1 year, contributed to 70,000 premature deaths in North America and Europe. So here is the choice that we face. We are where the red line stops and the dotted line begins. And we have pledged to go on that blue line. That's what the Clean BC plan says. We all support that. However, it's the dotted line that we are on, the red dotted line, with LNG Canada Phase 1, wood fiber LNG, cedar LNG, siliciums LNG, and LNG Canada Phase 2. These facilities will drive emissions into the 3 to 4 degree range, which is not compatible with the life we are living today. So what have we done? Well, we have cut 2.3 million tons of pollution since 2007, but the approved LNG projects showed you will increase emissions by 20.2 million tons. And that is just the very beginning. What you'll see here, as Tracy takes the ribbon, is what 130 million tons of emissions looks like compared with the 13 million tons that we are emitting because of our gas facilities. So the burning of the product brings you that much emissions. And all we're talking about, she has to go out the door. All we're talking about is the 13 million. This is a sham. That's the real damage. Talk about flaring, because flaring is something that has also been pushed under the rug. Flaring is the burning off of excess gas, as you saw in the CBC photo. It is particularly intense during startup. And I'll talk quite a bit about startup, because what the research that I've been involved in has shown is that startup actually has more emissions than, by far, 3 times more than routine operations. And all you hear about is the routine operations. So these are the LNG Canada flares. These are the only ones that we know about, because this is the first facility to be operating in British Columbia. It has 5 flares. Sometimes they all operate at the same time. Sometimes it's just the warm, wet flare. It is a polluting way of releasing excess gas. What we've shown in this study, using satellite information, because the information coming from the industry is woefully inadequate, we use satellite information to analyze flares from 64 different facilities around the globe. And in that, we showed this difference between startup operations and routine operations. In fact, during startup, there are 3 times more emissions. This research was done by my colleague, Dr. Laura Monet, at the Clean Air Lab at the University of Victoria. And the startup was the highest emissions, but also that it lasts much longer than what industry says. So later on, you'll hear a little bit, and maybe we can get into it in the discussion about what has been promised for the wood fiber LNG. Only a few days, only a few hours a day. What we're seeing in reality, though, is that the flaring is intense, and it lasts for years, and it is clearly impacting health. This has been reported, thankfully, and we are hoping that we can, with this information, change BC's health risk assessments, which to date have been inadequate to protect public. Why is this? It's because of these pollutants: nitrogen oxides, sulfur oxides, particulate matter, benzene, and other carcinogens. This sounds bad, and it is, but we have a particular distinction here in Vancouver. What you see here are the benzene concentrations measured indoors in the different cities in North America listed there, from Vancouver on the left to Boston on the right, in the order of benzene concentration. Our gas has the highest benzene concentration in North America. Flaring during the startup and commissioning of LNG Canada began in August of 24 and is now entering up to 2 years. Kitimat residents have been notified of excess flaring for 33 days in February and March of 2026. This is well after routine operations are supposed to have started, which is, according to the industry you saw on their pretty video there, supposed to be much lower, very pleasant little flame at night, just everything is chill, right? Well, this flare regularly reaches up to 90 meters. And you'll hear more about what this is like from Ankur later. So LNG Canada has been flaring up to 15 times more gas than expected. This is actually an underestimate. It was an average over several months that included some low months. The month of October 2025 was between 60 and 80 times what was authorized to be flared. Why is this? Because the flare is not functioning correctly. It is an engineering flaw. The malfunctioning flare was the #1 record-breaking flare in the entire world in 2024. This includes Nigeria, Algeria. Finally, last week, the BC Energy Regulator found non-compliance. Too much black smoke. And I hope you don't get upset by this, LNG Canada, but we are going to make you provide us a report by August. And if you could please, could you do something about this by October 15th? This is not the way to protect public health. Why are we concerned? Because those gases that I mentioned increase the health risk for asthma, chronic obstructive pulmonary disease, the #1 respiratory condition in Canada, heart attacks, preterm birth, certain cancers, and overall early mortality. We know this is expensive for the health system, and we know this from research that's been done in the United States. This is from the Louisiana coast, where most of the LNG facilities in the States are. We know this is happening worldwide. This is a plant in Australia, where the company originally reported 4 tons of benzene carcinogen, potent carcinogen, was released, but then they had to revise the figure to over 500 tons. This is the attitude that we are facing from an industry that has been able to run for decades now with very little scrutiny until only the past decade. So I just want to briefly talk about this facility, Tilbury LNG. It's a relatively small plant that has been operating in the Fraser River at 0.25 megatons. It is slated to expand by a factor of 10 to 2.5 megatons. And with that will, of course, come flaring. But you won't see it, because that would not be good for the image of Fortis gas. So the flare will be in a stack like this at ground level. It says it is enclosed, but you'll notice something about the enclosure. It's going to be, of course, polluting just as much as another style of flare. Fortis estimates that the flaring during commissioning and liquefaction at the LNG Tilbury plant will last for only 72 hours for the warm stream and 144 hours for the cold stream. Do you believe that? What we know comes from a single study in Environmental Health Perspectives in 2020 that is still the only published study on flaring from unconventional gas development. And in this study, it was noted that if you lived within 5 kilometers of a single flare that flares only 10 days per year, the premature birth rate increases by 50%. So that's for you epidemiologists out there, relative risk of 0.5. And that is quite significant if you look at where Tilbury is. It is the island itself an industrial zone, but that circle includes thousands of people living in homes. The proximity to the nearest business is 71 meters, the nearest home 440 meters, school 4 kilometers, well within that 5 kilometer zone, childcare even less, and the senior facilities also within the 5 kilometers, and a hospital just outside 5 kilometers. So we know that this is a problem because the airshed is already polluted. New Westminster in 2023 had the worst nitrogen dioxide level in the province. And this is going to only add to that. So what you see here is the number of exceedances of the standard for nitrogen dioxide per year. And that purple zone is up to 10 exceedances per year. The lighter blue, 10 to 50 exceedances per year. The yellow is over 200 exceedances per year. So here we are permitting a facility in an urban zone and enabling nitrogen dioxide levels to go well above our so-called standard. If any one of you have asthma or chronic obstructive pulmonary disease, do not be hanging around the Tilbury LNG facility. We are worried about the health costs of LNG, and it is damaging from the beginning in the fracking fields to the pipelines that transport it, to the liquefaction in these plants that we've reviewed today, to the shipping, and of course, to the final consumer, the burning, the 130 million tons that you saw laid out here. I'm really happy to report that the Health Officers Council this past year did pass a resolution asking for a cumulative independent health impacts assessment following on the wise words of Canadian Association of Physicians for the Environment, Canadian Association of Nurses for the Environment, and others now who have called for this cumulative independent health impacts assessment, because the truth of it is we do not know what the impacts of this chain of harm is. So we are getting a little traction, and I'm really happy to be able to present this slide, which shows city councils standing up, paying attention, and supporting our call for a health impacts assessment. So I'm going to close with this. I'm really happy to discuss any of these actions, but this is where the rubber meets the road. We need to promote this health impacts assessment. We need better monitoring of our air quality. Benzene is not even monitored. We need to hold the LNG industry, and we need to hold the regulators accountable. And this is a fundamental problem, which I hope we can get into discussion. The regulators are, as you heard from the LNG Canada example, not doing their job. So with that.
Thank you, Tim. I would like to introduce our next speaker, Ankur Patel. Ankur Patel is a registered nurse residing in Kitimat, located on the traditional territory of the Haisla peoples. Receiving his education in rural northwest BC and providing care in the region provides him with insight as a local healthcare provider in an LNG-facing community. He has also served the field of nursing nationally and internationally via his tenure on the board of the Canadian Nurses Association, current positions supporting the International Council of Nurses, and as an active member of the Canadian Association of Nurses for the Environment. Please welcome Ankur.
Thank you for the wonderful introduction, Tracy. Yeah, it is an absolute pleasure to be talking with you all today. Really, my role here is to paint a picture of what it's actually like to live in Kitimat, BC, what it's like to live in my hometown, and a little of what it's like to be a healthcare provider in the area. So I'm a member of the Canadian Association of Nurses for the Environment. So we're a coalition of nurses located across Canada who want to hold accountability to our ethic of protecting the land and the people that rely on it. So this is a photo that we took in Smithers. This was a town hall we hosted alongside CAPE, our physician counterparts, Indigenous land protectors, and we frequently work alongside all members of the healthcare sector. So this is another image. This is our President, Emily Tremblay, with her speaking at the House of Commons, speaking on a ban of fossil fuel advertisement to make sure that our public is not misled on the impacts of this industry. And what I want to start with is a bit of a picture of our healthcare system to kind of situate the understanding of where this discussion is being led. So let's look at your healthcare. Let's look at the healthcare that you deserve as a BC citizen. And this is a picture that CANE members are quite aware of. And it's important for you guys to get this background as we dig into this photo. So first we'll start with the nursing picture. We have already been shown that we are facing an understaffing of nurses across this province. Thousands of our nurses are not able to enter this field, and we are facing a staffing shortage. Already our healthcare system is under strain with not enough healthcare resources. So when we look a little bit deeper into this, we're also finding that we're facing more violence in the workplace. Nurses are facing safety issues, safety concerns. So the nurses that we do have in the picture don't feel safe coming to their workplaces. They don't feel safe entering these care practices. And really what this picture kind of ends up with is a large scale of burnout and attrition. We are not meeting the amount of nurses that we need to regenerate every year to care for your needs, for your family's needs, your children's needs, really for everyone you rely on. We are here at the worst moments of your life. You want to be well-staffed, well-supported, and well taken care of. So this is the nursing picture. This is where we're starting off. And what does this mean for you? What is the impact on your healthcare quality and your healthcare picture? This means higher wait times. You guys are all very well aware of it. Wait times are going up across Canada. This means you guys are staying in ERs longer. You're staying with ambulances. You're staying in hallways. We're seeing 9 to 12 hours of wait time in the hospitals here. We're seeing ER and service closures. Our healthcare system is propped up by agency nurses, by private care, and mandatory staffed overtime, which is further burning out our nurses and meaning less care for you. This could be an extension of clinics, a delay in operations for months or weeks. Maybe think of that hip surgery a parent has had to undergo and take really forever to reach. And at the end of the day, this is lower quality of care for you and your family as BC residents. This may mean less assessments being done in time. This may mean a missed stroke, missed heart attack, missed sepsis. This is worsened healthcare quality for you and your family. So let's kind of move on a little further. Let's dig into the picture. Let's add another variable. Would you feel comfortable knowing that picture to access your healthcare system right now? Now, let's add on the LNG industry across Canada. And BC specifically, we're looking at health impacts. The province is rapidly expanding LNG infrastructure. And what does this mean for our healthcare system? How will it impact an already strained and stressed healthcare system? What will this mean for your wait time? What will this mean for the quality of your care? And really, what will this mean for the vulnerable population specifically? Think of the younger children, the pregnant mom, the older adult, your parents. What will they be facing? Will they have to require more use of this healthcare system? And in turn, driving up more healthcare strain. So what's the end result? I want you to kind of keep on chewing on that as we go across this presentation. Think of that and kind of resonate on that a little bit. So let's step back for a moment. I'm a registered nurse, a frontline nurse in Kitimat, BC. It is an absolute privilege to live on the unceded ancestral territory of the Haza peoples, and I am immensely privileged to receive my education as a locally educated nurse in the area. And what's kind of special about receiving a rural northern education is the emphasis of the land and its requirement for the people to thrive consistently. We are trained to look at the community and its transition to any industry in the region as a health concern, a health problem, and look to address this in a fulsome manner. So Kitimat is a town that's already inundated with industry. We are already seeing health concerns, whether that's increased respiratory diseases, increased cancers, increased GI discomfort. So it's a town already where we're facing a complex picture. So my role here is to kind of show you what it's like to live in Kitimat. So we'll play a bit of a game, if you guys will come along with me on this. I took some photos going around Kitimat, and I want you to see if you can tell the difference between these photos. So here, on the left, we have a photo I took scrolling downtown. You know, it's a bit of a gloomier night. You know, the clouds are out, and you might have to look at it a little bit closely to spot the difference. So here, let's see if you guys can notice. Do you guys see any difference between those two photos? It kind of looks like there's a fire coming out of the trees or something. Interesting. So here, let's try again. So this was a beautiful walk. I took this on Heisla Hill. And you know, it really paints a picture of what Kitimat is like. It's a wonderful community. You know, we have vehicles in the foreground. We have our community sprawling in the background. We have the beautiful trees, the mountains, and really the sky looks wonderful, doesn't it? Okay, pay attention. You're gonna have to look real close. Can you notice the difference here? So this is an interesting picture. You know, you're seeing a large stack, a little bit of a flame there, and this black smoke emanating across our community. Interesting. Imagine living in Kitimat for your whole life, building a house, living there with your family, your employment, everything you have ever known is in this region. And imagine the shift between those two photos. Let's do one more. So let's say you and your family, you wanted to dress up, get a little fancy, visit the Chalet, a wonderful restaurant in our downtown area. You know, it's a nice little picture of the downtown here. So here, let's check out the next one. Now, imagine that, looking out your window, eating your steak or burger or whatever you enjoy. Imagine seeing that with your children, with your parents, with anyone who has any semblance of a health condition already in the community. How would that make you feel? So I really want to try and build the picture of you. I want you to imagine what it looks like, what it smells like, what it feels like, and what it's like to breathe the air in the community. So we'll go through a few photos to get through that. So here are some wonderful photos of my community, which I have lived in. And here's an example of the alerts that we receive when the flare is exceeding its normal amount and is possibly a risk to human health. They put out these advisories for community members to be aware, but one of the issues with an advisory is you kind of need to advise people before the issue has happened. This doesn't happen all the time. A lot of the time, we are receiving these advisories after the fact. Even just yesterday, I received a message on my phone that there was going to be a large flare up to 90 meters going on. So here, let's dig through a few more photos. This is the endless night sky we have in my home community. Here is the sky lit up like a torch. Now, imagine you can see the light picture real well here. Imagine the sounds associated with this. Imagine the booming, thundering waves kind of crashing through your house. Imagine trying to sleep through the night through this. So to end off my piece on this portion, I wanted to work through what some of my community members are saying, some of the people who I care for every single day. How are they feeling? What do they need to say about this issue? Even this morning, it was 75 to 80 decibels inside my bedroom. We got maybe 2 hours of sleep this whole weekend. I'm just useless now. My backyard was covered in gray smoke while I was cooking hot dogs. You get the smell for a few seconds. It's like burnt plastic or styrofoam. Is there going to be 40 years from now, 30 years from now, the incidence of cancer going through the roof? These are the questions people in my community are asking me. I've been having like a cough, runny nose, headache at nighttime. My boy, the same thing. I'm at a wit's end with the noise and the smoke. I've built this house with my own hands. I dug the foundation, poured the concrete. I put everything I own, all my savings into it. Now I can't even sleep in my own house. My house was lit up like daylight, shaking from the noise. On top of that, there was an ear-piercing whistle. How would this change the way you live? How would this affect the way you go through life, the way you go to work, when you go to the grocery store, when you talk with friends, meet with community members? How would this make you feel? And finally, I want to end it off with my experience as a healthcare provider in my community, as a registered nurse. And I'm seeing increased symptomology from both my residents and my patients alike. They're reporting that they're having more difficulty breathing. They're having increased symptoms that they're finding is actually in line with when they're seeing this large amount of smoke in the community. They're finding that these are completely connected for them. They're relying on their medications more often. So patients with respiratory concerns often rely on bronchodilators or puffers to open up their airways, and as they deal with their medical conditions. And they're saying that they're relying on these puffers more often. They're having to use them to just get through daily tasks, whether that's going to the grocery store, whether that's gardening, whether that's spending time with the community. They're forced to use their medication more often just to live, just to exist in the community. And the biggest thing is I'm hearing an increase of questions. As Tim said, there really isn't enough research being done on this. They're concerned for their families. They're concerned from their parents. They're concerned for everyone around them. And we don't have the greatest answer for them because we need the research to be done. My community is concerned, and they're facing this each and every day. And I can only try and paint the picture for you. Sorry, it's difficult to say this sometimes. I can only try and paint this picture for you. And I just want you to try and imagine living next to this each and every single day. Thank you.
Thank you, Ankur. I also just want to point out this picture quickly. This was taken yesterday. This was yesterday. And they've stopped flaring from the main derrick, which is 120 meters high, and they've started using the 60-meter high derrick. We don't know what they're doing up there or what the issues are or how they are trying to resolve this flare tip issue. But the fact that they've told the community, we know this is malfunctioning, too bad, it's going to be 3 years before we fix it, suck it up. That's not okay. Right. I'd like to introduce our next speaker. Dr. Melissa Lem is a Vancouver family physician who also works in rural and northern communities. She is past president of the Canadian Association of Physicians for the Environment, co-founder of Canada's Nature Prescription Program, Parks RX, and clinical assistant professor at the University of British Columbia. An internationally recognized leader in the field of nature and health, she is also engaged in advocacy and policy work on a broad range of issues from extreme heat, LNG and fracking to sustainable healthcare and low-carbon transportation. Please welcome Melissa.
Thank you so much, Tracy. And it's been really interesting to sit here listening to my colleagues speak about their experiences, both from the research side, but also the personal experience side. And I just want to make it clear that I'm speaking on behalf of the Canadian Association of Physicians for the Environment right now, not any of the other organizations that were mentioned. But so I think Ankur has really vividly described for us and shown for us how flaring, how LNG Canada has been affecting his community in the last 1 to 2 years. But a lot of people don't think about where the gas is coming from for LNG Canada. And the interesting thing is that the majority of people within BC support the LNG industry, but the majority of people in BC oppose fracking. It makes no sense because, as we know, LNG comes from fracking, so people are not making this connection. And these kinds of health harms that Ankur described have been happening for at least 1 to 2 decades upstream, so in the northeast of BC, where this gas is fracked. And what I wanted to do today was to share some stories from some people who live in these communities upstream, just to show you how fracking is also affecting local health. So this is Dr. Ulrika Meyer. She is a force. She seems to be the only physician living within the Peace region of BC where fracking happens who's willing to speak up in public, and we owe a huge debt of gratitude to her. And so I just want to read what she told me about the experiences she's had. So she said, I have some patients whose symptoms I can't explain. There's one, an older farmer in his mid-70s who likes to dance. His farm was surrounded by a multi-well pad and open wastewater tanks. Shortly after the flares went up, he developed episodes where he would suddenly pass out. We adjusted his medications, did a Holter, CT angiogram, brain scans, and referred him to a specialist in Edmonton, but couldn't come up with anything. When they were done with all the fracking activity and sealed the sites 2 years later, his symptoms disappeared. He's had no other episodes since. My neighbor used to live on 17th Street. When they started flaring nearby, he developed severe nosebleeds. He had multiple ER visits. At night, when he was sleeping, he would almost choke on the blood. His wife would wake him up because of the sound. He sold everything, his beautiful renovated farm and business, and went to Arizona. He came back 3 years later, rebought his business, and moved to my neighborhood where there's no flaring. I've never bought that many pillows before, his wife said. I can't make the industry go away, but they should have to comply with strong regulations. We should be able to test the canaries in the coal mine who might be getting symptoms from exposure to toxins. I think we should use a top-down approach, test the humans and animals in the environment because we breathe the air, we drink the water, and are part of the web of life. And this is Karen Hosford with her 2 beautiful children on her property, actually, where she used to live near Dawson Creek. And she's now moved away because of the local health impacts and her concerns, like many people, which I'll talk about later. So just some quotes from her. It used to be peaceful. The kids would play on the trampoline. We'd have birthday parties in the backyard. But on one of the nicest spring days, we were lying on the trampoline, and all you could hear was a droning, drilling sound. Now we live within 3 kilometers of 96 sour gas wells. There's an open fracking wastewater pit, flare stacks, and water towers bigger than our house above our place where my husband used to hike. Everything under the sun is being gassed out. I thought I was fighting for my own little area, but it's everywhere. I'm worried about fertility. There are tons of people with cancer. A 7-year-old girl who's a family friend was diagnosed with a brain tumor last week. This is the 4th child under 8 that I know of diagnosed in the last 4 months. And Dr. Meyer actually recently told me in one grade 2 class in one school, 3 children with cancer or brain tumors. This is not normal, and this is being allowed to happen. I know you need an economy, but I've worked from Alaska to BC in mining, and my mind is blown by this industry. If I did these things in my job, I would be fired on the spot. No one is taking any responsibility for the damage to the environment and human health. We had a little piece of heaven, and now it's all gas and flare stacks. So it's affecting not only the healthcare system, and with physicians actually leaving. I've spoken with multiple physicians, at least 7, who have pointed to at least 7 physicians in recent years who have closed their practices quietly, packed up their families, and left, attributing this to their concerns about the community and health impacts of the LNG industry. Within Dawson Creek, it requires 15 to 20 physicians, family physicians, to staff the ER and provide primary care. So this represents about half of the physician complement required to run this town. So not only are people getting more sick, but they also have poorer access to health care. These are Tim and Linda Ewert. They are organic farmers who live in Puskapee, BC, which is quite close to Dawson Creek. And I'm going to read you some words from them. So they said, "We're trying to farm in a way that requires no outside input. We build soil with compost and green manures and do farm work with horses. We rely completely on solar power to run our lights and the coffee grinder. We try and have our electrical use match the sunshine. But when fracking showed up, it had quite an impact on our lives. With all the traffic, all the dust, the danger on the road, it was no longer safe to drive 4 horses there. We lived in a cloud of dust. If you looked down at our farm and vegetable field, it looked like it was in a fog. We have a lovely spring that was used for all of our drinking water for years and years. The flow was exactly the same during the coldest, the hottest, the driest weather. But all of a sudden, one day when they were fracking near us, there were only a few drips of water coming out of it. One year in December, we were splitting wood and we could smell this horrible, horrible smell. We thought surely the companies would be careful not to put something like that in the air. The next morning, we woke up with the most incredible headaches and violent stomach upset. For a couple of days, we could hardly crawl around and look after our livestock. And Encana did admit a couple of days later that somebody left a valve open on a tank. They wouldn't say what was in the tank. Our oldest son came back home around 2000 in the year or so that the drilling was unbelievable. We remember him saying, "It looks like Kuwait. It looks like there's a war. It looks like the whole place is on fire." It's heartbreaking. We always imagined passing our farm down to our kids. It has taken a toll on our mental health, and we've had to be quite aware to pull ourselves out of it. Our philosophy of being here is to put back in as much as we can to improve the soil and the community, but the oil and gas industry's approach is a diametric opposite. And this is the last story I'm going to share from Carl Mattson, who is I believe he's a 5th or 6th generation farmer who lives in Rolla in the same neighborhood. And we hosted him a couple years ago down in Vancouver. He's a farmer and an artist and an activist, and a reluctant activist, he says. So Carl has, oops, that's actually Ulrika's. Here we go. So something that he really points out is how fracking tears communities apart. And this is what he says. So there's been a crazy influx of oil and gas development since I was a young man just starting to farm here. Within a 2-mile radius, there's a labyrinth of high-pressure sour gas pipelines under our farm and the roadways. If we have an H2S gas leak near my home, we know that the ability to be rescued is minimal. They don't have enough emergency staff or equipment to go around farm to farm and alert people or get people out. We're out of sight, out of mind here. We have some of the best farmland in BC. With the quality of soil, our long summers, and our unique growing season, we can grow amazing crops here. So for the oil and gas industry to be able to subdivide and take leases and just kind of run rickshaw over prime farmland, in this age we're in, when we're worried about food security, it's a very serious business. Farming is a risky venture. If you don't take fracking infrastructure on your land, they'll just hop right over to your neighbors, and they will reap the monetary reward while you get directional drilling under your farm, sucking resources out of your land anyway. That's why I think it slowly divides communities. It pits neighbor against neighbor, divide and conquer. So these are just some stories from the people who live in the northeast of BC that we've been speaking with, that Cape and Kane have been speaking with over the last few years. And I think when people think or talk about how much this industry is driving improvement in the economy, think about how much it's driving unsafe housing, how much it's driving lack of access to healthcare, health harms, lack of community cohesion, and actually affecting our food security. These are issues of high priority to people in BC, and these are issues that are converging in a major way within these fracking communities. And so you might ask, what has Cape been trying to do about this over the last few years? So Cape BC was the first regional committee as part of the national organization of the Canadian Association of Physicians for the Environment to form in 2016 and 2017. And I started connecting with them in 2017, shortly after I moved out here. And there was this event at Heritage Hall where David Suzuki spoke. He was a keynote where a number of people from the north came down, including Dr. Meyer, including Karen Hosford, to speak about their experiences. And I was looking around the room as they were speaking and thinking, I've never heard such horrible things. How is this permitted to happen? While at the same time, the greenhouse gases that this industry is releasing is going to torch my child's future and accelerate climate change. And so I thought, what skills do I have? You know, that's the question. When you see something or you hear something that's wrong, that's going on, you want to do something about it, particularly if you're a healthcare professional. You almost can't not speak up about it. And so I was a senior writer for the CBC for many years. I've been working in the TV, radio, broadcast industry as a medical expert for about 15 years now. And so I thought, okay, well, I need to put some of these stories down into writing. You know, research is important to move government, you know, to inform industry, to speak with each other as colleagues, but more people need to know about this. So I ended up writing the first ever journalistic article for the Narwhal, where I interviewed Dr. Meyer and a number of her colleagues. The first one where actually local health professionals were interviewed, and their stories were shared. And since then, we've continued to try to share these stories. This was the very first kind of public campaign that CAPE ran. This is 2021, and we were trying to bring gas home to people, trying to make them aware of how gas was being used in their own neighborhood, not just up north being fracked and kind of shipped around via pipelines. And so this is the amazing Kane nurse Helen Boyd and Dr. Kevin Liang holding our banner around linking LNG natural gas to ferry use, and it got a lot of attention because of controversy. The owner of the banner, or the kind of, this was not super happy. BC Ferries was not super happy. But I will say it actually likely contributed to one success story, was that about 2 years ago in 2024, BC Ferries actually announced that they were going to invest in building their fleet with all electric ships. So we contributed to that success. And I think we actually don't celebrate our successes enough. This is a pretty significant success. And this is another story. So this is the amazing Dr. Lori Adamson. She's an emergency physician in Salmon Arm. And I remember a meeting after all the horrific things that happened in 2021, the heat dome, the record-breaking wildfires, the most expensive flooding disaster, climate disaster with the flooding and the atmospheric river that happened. And her son happened to come home from school holding lessons that Fortis BC had actually made available on their website that teachers across BC were using to teach their children about climate change and about energy. And she said, this is like propaganda. I cannot believe that this is permitted to be shared. And so she actually spearheaded a campaign that brought in the BC Teachers Federation, that brought in a number of health organizations and other organizations to call on the BC government to essentially prevent Fortis BC from spreading their lessons around schools. And in fact, this made national headlines, was covered by the Globe and Mail, Canadian Press, and then I think it was within about 2 weeks, Fortis had taken that curriculum off that biased curriculum off their website, and to this day, so this is now 4 years later, the curriculum has not been added back. So that was another success where we actually took this biased kind of brainwashing information away from children, and now kind of just neutral sort of climate education that's created by another party is being shared on that website. So another success. We're really trying with CAPE and Kane, really trying to underline this connection between health and try to make it come home to people as much as we can all over the province. And so we've also engaged in campaigns where we raise awareness about the indoor health harms of burning gas within your homes. So this is Heat, Cook, Breathe, a campaign that is led by CAPE, and essentially it not only illustrates the harms of burning gas inside your home for cooking and heating, but also provides resources around solutions for how to get your home off gas, and actually direct links to organizations that will help you with that. So, again, and highlighting this fact that kids in homes with gas stoves are 42% more likely to develop asthma, which is crazy. It's similar to the health risk of living with a smoker in terms of asthma incidence. So it's not only, again, fracking LNG, not just affecting outside environments, but also right in our own homes. This was the first time that CAPE started to try to get the wider healthcare colleagues on board, so not just the converted. And we, in fact, declared a health advisory around LNG. So Dr. Kevin Liang actually came up with this idea. And so CAPE and others and a number of, over 500 doctors and nurses signed off on a declaration of LNG being a health hazard and started to get attention for this. The next year, we actually started to highlight the healthcare system harm. So this was a year when a lot of ERs were starting to shut down across BC, and there was a lot of attention happening around lack of access to care. And so we launched a campaign called LNG and Healthcare. The website's still live, lngandhealthcare.ca, where we highlighted the healthcare system impacts of the LNG and fracking industries. And so, you can see us holding our placards there, and the great thing is that we brought in a lot of mainstream colleagues. So we have, the head of respirology from UBC standing in this crowd here on the right. We have a neurologist, we have a nurse, a paramedic, family doctors. We have an infectious disease physician standing there, all highlighting the risks of LNG and fracking on our health and our healthcare system. So it was, again, an attempt to bring in the health voice and our colleagues, because we know that health is one of the most effective ways, the frame is one of the most effective ways to convince people to support policy proposals and get people on board. So this is just a kind of an excerpt from the website. And then last year in 2025, you've seen pictures of this already. I'm really proud of the work that we've done to try to build support across the province. So not just kind of urban elite physicians and nurses talking about these issues, but this is one of the reasons why we have Ankur sitting here today. This is one of the reasons why Dr. Sally Harvey, who's standing there in that right-hand picture, she's a radiologist who works in Smithers, are all coming on board to raise awareness about the local health harms of pipelines, of fracking, of the LNG industry. And the more we engage these strong voices, I think the more attention we'll get. And so just to end, we're not only kind of doing these media and public relations campaigns, but we've also launched art shows, this website, a Healthy Climate Solutions Fair we're launching again, where we're illustrating all the ways that we can transition off polluting industries like gas and other fossil fuels towards a cleaner, healthier future. I think the more we come together with Indigenous leaders, with mainstream healthcare sector leaders, with other environmental groups, and with you sitting right here in this room, the more success we'll have. And I think the call that has been spearheaded by the Health Officers Council, based on the advocacy that CAPE has been doing over years, I think is one of our best bets to start to change the regulatory framework and to start to change people's opinion about fracking and LNG in BC, and hopefully move the majority of people in BC and across Canada away from supporting fracking, just like they don't support supporting LNG, just like they don't support fracking. So thank you for listening.
Thank you, Melissa. I'd like to introduce Gina Mowat and Shaylin Sampson. Gina Mowat is a member of the Gitxsan Nation. Along with their work as a Acute firekeeper, Gina is a registered clinical counsellor and holds a PhD from the University of Victoria School of Child and Youth Care. Shaylin Sampson is a Gitxsan Acute firekeeper, artist, and media and communications operator. They have been on Indigenous frontlines since 2019, protecting Gitxsan and Wet'suwet'en territory from imperialist resource extraction. Please welcome Gina and Shaylin. Do you want to have 2 minutes?
We can share. Simgiget Sigedem Hanach Gangabaliksa Lumpgori Wengaten. My name is Shaylin Sampson. I come from the Gitxsan Nation, from the Lach Gibu, which is the Wolf Clan, and Wilp Spoch, which is the House of Spoch. I grew up in Heglaget in a shared Gitxsan and Wet'suwet'en village on Gitxsan Lachyip and below Stikyoden, our ancient mountain. I also have spent a lot of time on Indigenous-led grassroots front lines. For the longest time, I spent on Gidimden territory at the Gidimden checkpoint alongside Slato Molly Wickham, who is my mentor. And I've also been lucky to learn from a lot of the Wet'suwet'en leadership, including Denise Namox, who is in some of the pictures and has done some work with CAPE as well. I am one of the Lachyip firekeepers. I just came on in our new comms position, doing communications for our collective, and yeah, I'm excited to be here with you guys, and I feel like talking about the health impacts is so important, and I feel like having the perspective of Indigenous people in these movements is also just really integral to moving forward, because if you're talking about health impacts on Native lands without talking about also the impacts that Native people have been feeling from colonialism for hundreds of years now, then there's a big gap there, and so I'm stoked to talk to you guys today.
Simgiyat sigramanakan kabuwils needs a home laxliksta wai Wilps Lukatsuwas Gansamwitsin Wilsawitwi Laxel Padeki. My name is Gina Mowat from Wilps Lukatsuwas, white settler on my mom's side. My dad was Giksan. And yeah, I'm a registered clinical counselor and I teach part-time at the University of Victoria, also Acute firekeeper. And yeah, grateful to be here.
So I just wanted to talk a bit about industry resistance by Native people in our homelands, and also the Acute firekeepers and kind of what we've been up to as an organization, because it all kind of ties in. And then I kind of want to lean into just what is your place in this struggle, and how do you find your position, and how do you use that to your advantage. For me, I want to talk about why we resist. I am a Giksan young person. I've inherited a lot of responsibility, and I get to choose to be active about it. I spent years on Gidimden Frontline, and I feel like it's really important to name, too, that doing this work and being a land defender and fighting back against this injustice, against industries that are destroying our homelands, it takes an intense toll on our mental health as well as our spiritual health. Who we are as Native people is just so undeniably tied to our homelands and the well-being of our territories. On Wet'suwet'en Yintah, they drilled underneath the sacred headwaters, which is where our people have gone to for millennia to nourish ourselves, and we know that anything that happens in the headwaters obviously impacts everything downstream. And from Wet'suwet'en Yintah, Giksan Nation is immediately downstream, and so we've seen what the runoff of that water looks like in the spring now. It used to be that we could not drink the water for about 2 weeks in the spring, and now since the pipeline's gone through, that has gone up to about 2 to 4 months. And so that's a really intense jump, and that's the water when we're living out on the Yintah, that's the water that we drink every single day. And so it becomes a really big barrier for us to have clean drinking water. And it's also really rare to be in a place where we can still drink the water right from the river normally. And so to have that big shift happen, and knowing that it is directly a result of industry, clear cutting and putting in the pipeline, it's just super devastating to our people. I also wanted to talk a bit about just where we are at in colonization right now, the impacts of colonialism Native people have been feeling for hundreds of years already. We know what it's like to be taken away from our territories and to see the degradation of them for the benefit of the larger Canadian culture. And so where we are now, we're seeing that it's not only impacting Native people now, it's impacting people in urban and city centers, like here in Vancouver, and what you'll see with Tilbury and what's happening in Kitimat right now. It's happening not just to the Native people, we're not the only ones facing the impacts, and so it's really important to start thinking and looking back at our fights and our struggle, and see where we were successful, and think about where your place is in it now, here in Vancouver, in a really wealthy part of the province. What is possible for you to do here? And yeah, I'll just pass it off to Gina now.
Yeah, I guess just reflecting on that, what you just said, it makes me think about in our homelands, every beautiful inch of our territory that still exists only exists because our people have fought for it. It doesn't exist because Canada gives a care about us or our territories, but we've had to fight for it. And so colonization started on our territories in the mid-1800s. And since like first inception of settlers on our territory, we have been resisting, starting with mining, logging. My grandpa sat on logging blockades. My great-grannies on both sides had blockades on their territories. So we're part of a lineage of resistance that's handed down generation to generation. And every single generation since settlers showed up on our territories, we've had to fight. And we don't want to have to keep doing that. Like, it's heartbreaking the amount of times I've had to say this I'm 34 years old. And so our people have always been disposable. We're a disposable population. Our lands are seen as disposable to Canada. That's how we're treated, and that's how we've always been treated. And that's our perspective on this resistance, which I think can feel really different than white settlers' perspective. So like noticing the difference between our presentation and the presentations earlier, we are feeling this, Shay and Art are here talking today because we're currently facing another project on our territories, the PRGT pipeline, and we're getting ready for another war with Canada. Canada's at war with us. I have 5 minutes to speak, so I'm going to try to do my best. So I think that, like Shay was saying, there's bodies and there's places that are marked for violence, and just violence is inevitable, which is reservations, our territories, and also globally around the world, the global south. Canada inflicts this kind of brutality on territories and people. 80% of mining around the world is owned by Canada, and that industry is extremely violent and has been noted by the UN as having slave labor, child labor, just gangs around the world. And this now, I'm kind of learning a lot in terms of like the project wood fiber and Tilbury here is imperialism's coming home to Canada. And I think Canadians are feeling that imperial violence that we've felt in our homelands, in Canada's backyard and around the world. Canadians are going to start to feel that. And I think it is actually going to require people to think about the implications of, how this country was built and what, it was built for Canadians, and starting to question, like, how do you challenge that? And I think it asks a different question, like in the last forum we did in Squamish, like, people trust the government and of course we're going to write letters and we're going to do petitions and like the government will listen to us, like populations that the government has served. I think people are going to learn maybe a lesson from us is that like the government, and we don't trust the government. And like I said, our families, generation from generation, we've learned that we can't, and we have to find other means of protecting ourselves and protecting our territories. And so maybe we can talk about that in the Q&A part of like what our resistance has looked like and what we've found to be important and successful. Me and Shaylin occupied the legislature in Victoria for 3 weeks. We occupied the Ministry of Energy, Mines and Petroleum Resources. Our people have blocked highways, have blocked railways. So tactics that the only way that we've ever been able to get the government to listen to us is meeting them in that way. So that's our perspective. Yeah, that's all I'll say.
Yeah, I think I just want to finish up with some like little calls to action. I know there's like some bigger ones that will come up after, but I think it's really important to just learn the history of the places where you are, because even here in this like mega urban center, like this is the traditional territory of people, like they have a history here. And even in recent years, there's been like really significant resistance on these lands. In 2020, like all of the ports got shut down, the ferry's been shut down, and like there's like really amazing history of resistance here if you're willing to look for it. And I think it's important to have on-ramps like for people to write letters and write petitions, but you need to look deeper and to see what is it that will radicalize you, what will help help you see our perspective, and how will you find your place in this resistance and find your own reason to be there. It's really easy to look at people like me and Gina, or like Denise Namox, or our colleagues that are Indigenous leaders, and to follow them because that's who you think is right. But it is a lot stronger to find your own place in this movement by having your own reasons to fight and having your own reasons to resist. And so I just really encourage people to look at that and think about being in this place of such immense wealth, and thinking about what can you sacrifice, what can you offer to advance this and protect your own health as well as other people's.
Thank you so much, Gina and Shaylin. It's very difficult to follow the calls to action that you have made. I'm going to speak to some other calls to actions that we can do together, but just also want to acknowledge the calls to action that you're calling for. So what can you do? What can we do together? First up, I want you to take out your phones, and I want you to get this survey up. If the QR code doesn't work, then the survey link is mycitysky.org/survey. Sorry, that has cut off. So please take a moment to get that open. I want to come back to this article from Louisiana, where LNG export terminals are posing a growing and invisible threat with air pollution. This is what Travis Data, who is a fisherman and a shrimper from Louisiana, had to say. My advice to the communities where these things are coming, try to stop them. Because once they get rolling, the flaring doesn't stop, and they get to make up the rules as they go. We know that people power works. We know this because with wood fiber LNG and what we've been doing in Squamish and now Catsum House Sound, we have held wood fiber LNG and FortisBC accountable again and again. And because we have held them to higher standards, the project was delayed by 8 years, and it increased their costs from a $1.6 billion project to an $8.8 billion project. So this is an example of how people power works when we come together and we stand together and we hold these companies accountable and we demand that they do better and we make sure that they're following the law. And I want to share right now, FortisBC is not following the law. They are violating their permits and discharging toxic pollutants into our Catsum House Sound. Wood fiber LNG is also doing the same. And we are doing everything we can to stand together to defend this land and to hold these companies accountable for these gross failures. So there are a number of different petitions that you can sign. I want to share how petitions work for us from our perspective. We first started collecting petition signatures to stop wood fiber LNG back in 2014. We delivered it when we hit 2,000 signatures. We delivered it again at 5,000. We delivered it at 10 and then 15. What we have heard from politicians, from settler governments, is that this shows to them how many people are opposed to these projects, and it has had an impact. It has had an impact on the decisions that they are making, how they are making them, because they recognize the power of the opposition. So there's a number of petitions from both Wilderness Committee, Stand.Earth, Canadian Association of Physicians for the Environment, and My Sea to Sky that you can sign on your way out. We actually have a take action pages on there. These are some of My Sea to Sky's actions. So I encourage you all to do that. We have several different letter writing tools, again, just calling to halt LNG expansion until health impacts are studied. And this is, again, targeting settler governments. We are hoping to demand that LNG Canada should be shut down until they fix this malfunctioning flare. LNG Canada must be shut down, they must fix this flare, and they must stop pollution that is harming people. So Standard Earth also has a letter that you can send specific to the Tilbury LNG project. There is an environmental assessment process that is going to be coming up for that soon. If you join the various mailing lists of the organizations that are here tonight, you will be alerted, and there will be guidance on how to participate and how to be most effective when you are participating in those processes. I will say that the environmental assessment process is completely broken. Completely broken. We are looking at or experiencing systematic regulatory failure of the Environmental Assessment Office and the BC Energy Regulator. I want to acknowledge that. But the way that we can challenge them is by participating in the process and then fighting them in the courts. And that is what we are setting up to do. So to do that, we need all of you to participate in that process so that we can show that there is public opposition again, that these are public interest issues, and then we can challenge them directly in the courts. So Wilderness Committee also has a letter. Canadian Association of Physicians and Nurses for the Environment have a fantastic site called Protect Health from LNG. There's several actions that you can take through there. One of the things that Dr. Takaro talked about a little bit, the call to action from the Health Officers Council of BC, calling for a cumulative and independent assessment of the health impacts of LNG and fracking industry. We're seeing local governments support those. So what can we do in Vancouver to get the various local governments to support that, specifically with regards to Tilbury LNG and how that is going to change the quality of the air that we breathe here in Vancouver? It's also really important for you to meet your MLA, meet your MP. They need to hear from us. We are not being able to reach them. They are only hearing from industry. So it is really important that you take the time to go to their office, form a relationship with their staff, like harass them, harangue them, like they really need to hear from you again and again and again. We need to build that public pressure, and then we need to vote in leaders that will actually protect us, and that will protect the environment, and that will protect our climate, and that will stop fighting the Indigenous peoples of this land. I ask all of you to consider volunteering. If you are a doctor, please come, or a healthcare professional, sign up to volunteer with the Canadian Association of Physicians for the Environment, or the Canadian Association of Nurses for the Environment. There are several other organizations here. There's volunteer sign-up forms outside. Please help. The other thing that we are looking to do, and again, this comes back to accountability and fighting this industry through the courts. We are aiming to set up air quality monitoring in both Kitimat and Squamish. We need to measure the pollutants that the government and the industry are not measuring, and that is specifically benzene, toluene, ethylbenzene and xylene. So we want to purchase a BTEX monitor. We want to purchase 2 of them, actually. And we're doing this with the University of Victoria. We're hoping to get, it's too late for Kitimat, but we're hoping to get an air quality monitor set up in Squamish so that we have at least a year of air quality data before wood fibre LNG starts flaring. And we're still going to fight like heck to try to stop that facility from going ahead. We are still working as hard as we can and fighting wood fibre LNG through the courts to shut that project down for good. So if you can contribute, we're trying to raise $40,000. The University of Victoria is applying for grants to also support this. And then we're going to explore some other options. Potentially, maybe our local governments should be paying for this. Maybe the provincial government should be paying for this. But we're not seeing that. And so we, as citizens groups, have to do it ourselves and then hold them accountable. So please help contribute to that if you can. And with that, I'd like to move to Q&A. I'd like to ask everybody to please keep your questions brief and take advantage of the incredible people that are standing up here tonight with us, all of their experience and expertise. And if you haven't already, please take a moment to fill out the survey. Does anybody have any questions?
Okay. My question is in response to the presentation from the nurse. There was a text message that you included about excessive flaring. I'm wondering, is there anything that people can do in response to receiving one of those text messages to try and like what is the utility of getting a message like that? You can't just stop breathing, right? Are you going to stay inside? Is there anything that literally can be done? Or are you just I'm now aware of this ominous news?
That is a wonderful question, and there's a few things members can do to protect their health. And sadly, you hit on one of them. One is to avoid exposure as much as possible. When you know that this is in your community, in your airways, this is what you're going to be breathing. Sorry about that. Whether it's having to stay inside more often or wearing protective airway measurements like masks while you're out in public, it's a difficult question that members of the community have to face every day, and it's a question we should be asking LNG Canada. What are we facing? How are we funding this health impact study to really see what's going on?
Next question. There we go.
Hi, I'm a third-generation settler from the Latako Dene traditional territory, two-thirds of the way up the Fraser River in Quesnel. And I just wanted a quick response that sometimes it does work, and we get to celebrate for long after. I was involved in 1974 in keeping the coal in the hole in the Hack Creek Valley with the Bonaparte First Nation and many hippies and farmers and ranchers, and every year the Morgan family invites people back to the meadow where there would have been a 400-foot toxic slag heap, and that's been over 50 years now. And so we celebrate it big. So there is light at the end of the tunnel in terms of things to celebrate. My question, I'm very impressed with some of the impacts of quick meme response that I see going on around me. When Donald Epstein does his late night tweetings and the Legoland rap responses pop out over the web and flash across the world, those kinds of things are doing wonders for really exposing truth. I think of Juice Media from Australia, some of the work that they've done. I would love to see a coordinated response among all of these mentor groups and people for that kind of quick, hard-hitting response. My daughter and her family live in Half Moon Bay, and I think of those tankers coming around the corner and into House Sound. And, a meme of one of those tankers, if it blows, would have massive impact for Horseshoe Bay and Vancouver and everybody on the coast here to see what we might be facing.
Just a comment on that. That's a great idea. And I actually want to point out that everyone, or almost all the health professionals sitting up here, we do this off the side of our desks. I don't get paid for this. This is all volunteer. And so when something, appears on late night television or whatever, I'm at home with my son trying to get him to do homework, or I'm seeing patients. So it's difficult, and we can't do that kind of rapid response unless we have funds to pay staff like our incredible, CAPE staff that we work with. But this is why, support us and the work that we do so that we can be more rapid in responding. I will say that we did create the Declaring the Health Advisory campaign. We held it until actually there was a really horrific climate event. I think there was something, the wildfires were getting really bad, and then we deployed that campaign and got a lot of attention for it because of that. So we're trying to employ some of that, but we're constrained because we're, volunteer health professionals working on this.
Thank you each for your stories. They were really powerful. I have a question about the regulator. It seems like there's this missing link. The information you have from your lived experience isn't getting to the regulators who, as a citizen, I want to trust. So is that process completely broken, or are there things we can do to make the regulator reflect the reality you're all living and seeing?
Yeah, I think I can take this one. The short answer is yes, the regulator is completely broken. And let me just give you an example of why that is. So you've heard about the Kitimat flare, and that there is a mechanical issue with the flare that the company knew about for approximately 4 months before they even notified the regulator. Then the regulator took another 6 weeks to notify the public. So put that story on one side. On the other side, we're trying to get information about the wood fiber flare that is under construction. We need very simple design information about the flare in order to model what the worst case scenario might be for wood fiber emissions, what the best case and what a middle case would be. These are things that we can estimate based on meteorological conditions and the flare design itself and the volume of gas. So this information should have been known by the Environmental Assessment Office and the regulator when they offered wood fiber the permit. But we cannot get this information. The regulator says they don't have it. The Environmental Assessment Office says they don't have it. The only entity that admits it actually has the information is LNG, or is wood fiber LNG, and they are not releasing the information to the researchers who are funded by the National Science and Engineering Research Council. So that, to me, is a broken system. There are many other examples, but I can't take up the whole night.
While we're on the topic of flaring, I come from an oil and gas background, so let me just add a couple of points and a couple of questions associated with it. Flaring is a natural thing required for a new plant startup because they don't operate the way they expect. Initially, they take a while to get warmed up or started up. But having said that, you should understand and appreciate that every 4 to 5 years, those plants have to shut down for a regular turnaround, and you're going to have another flaring event, even if the process is running stable between those events, and it probably won't. That's one thing. The other thing that we need to be looking at is, why are we flaring all the time? And we're flaring all the time in LNG facilities because they can't liquefy benzene and heavy molecules. Anything heavier than ethane can't liquefy properly, or anything heavier than propane can't liquefy properly. It screws up the whole process, and the cryogenic process, then it causes things to freeze up and break down. So why are we allowing that kind of gas to come into the LNG facilities in the first place? It should be stripped off and sold off, and it should be done as saying at 100% or down to like 0.1 part per billion of those heavier molecules should only be allowed in there. And that should be where we put the controls if they're going to allow these things in the first place. So I encourage you to put those kinds of controls, or force the government to put those controls on the feedstock, which is what's causing a lot of the problems, maybe causing a lot of the problems in those new facilities.
Thank you.
Yeah, I'll just comment on that. Yeah, sure, it would be great if we had pure methane to burn, because then we would have water and CO2, which is only just killing us by climate change. But the answer to your question is, of course, it would be more expensive to do that. And so we're taking a choice here. Just as we are taking a choice about fossil fuels in general, we could be rapidly moving, like China, to renewables. Instead, we are choosing profit over people's health. And that's, I think, the same reason that we're not stripping out all of the toxic compounds that we could strip out. I mean, the benzene thing is really mind-boggling because there is no safe level of benzene. It's a carcinogen. It was the first chemical ever classified as a carcinogen in the 1950s, and there is no safe level. So I appreciate the comments. Yes, we should be taking all these precautions, but really what we should be doing is phasing out this industry altogether.
We have another question over here.
Hi, I'm from Kitimat, and I'm studying to be a paramedic so that I can work in Kitimat. So this presentation was devastating for me, and I'm very connected to the topic. Thank you. Moving on, my question is, what's being done right now to undo some of this propaganda campaign that has misled my community so that they can come to understand that they've just been lied to? And I also had another question about regulation, which was, I'm pretty sure the Haisla community should have been consulted on this and should have, were those checks just not done because the regulator is broken? So yeah, if you could answer them both.
Do you want to talk about truth in Kitimat?
Yeah, 100%. So I want to break down your question a little bit first. So to speak on the understanding of truth, how are we getting this information out there? What are we doing to make community members aware? And this is one piece of that process. We are working with Indigenous land protectors, with our physicians and our health professional colleagues to make sure that this is a public health question, to make sure that our community members are aware of this concern. We are working with municipalities, as we've just seen. I believe we're up to 4 now. Is it 4 municipalities which have called for a cumulative health assessment because we have looked before we leaped. The province has pushed this way too hard, and now we're taking steps backwards. We're trying to see the picture that they've already pushed forward. So it's a long campaign, but it's one that really needs to get to the picture of what are we actually doing. And we need to push this as far as we can. We need action at every corner that we can. So it's a difficult journey, but we're pushing towards it. And I think this is one of the very many steps we need to do. And so to move on to your next question, for the consultation process, this is something that LNG Canada has admitted to do quite well with the community that they've been saying. And it's a difficult question when you're working with the long-term ramifications of colonialism across our country. And if I may, I would perhaps pass this question off to Shay, if she's interested in...
Tina.
This Haisla is one of the nations which we've heard from in terms of, and the same thing has happened within our nation in terms of resource, but particularly PRGT right now is industry and Canada and BC have come to our leaders and said, this project is happening whether you like it or not, and it's inevitable, and so you can either take the money or not. And this is what happened with Haisla, this is what happened with our chiefs 10 years ago with PRGT, and yeah, like you were mentioning, Ankur, like after 150 years of economic, political, social subjugation, enforced poverty, it makes sense that people would take the money. And that's not a process of consent, that's coercion. And so, yeah, this is, unconstitutional, illegal, and so like that's what our communities are faced with. Yeah, I think something I wanted to touch on that I kind of forgot about earlier is that like looking at the context of Kitimat and the Haisla people too is really important because the pipeline that runs through there, constructed by CGL, faced significant opposition by Indigenous land defenders, including myself, and there was years and years, over decades, the Wet'suwet'en fought against that pipeline from going through, and we knew how bad it would be for our health, for our well-being, for our spiritual well-being, our physical well-being. And yeah, our people are just forced into positions after being forced into poverty and taken away from our territory, and all the things that sustain us. So we just get put in these impossible situations. And now even nations that sign on, like the Haisla, they're facing incredible health impacts. And that territory in general, it's just been so overwhelmed by industry for so long with the Alcan aluminum smeltery, all of the logging and the mining in around there. It's insane. And the Wet'suwet'en, they had some villages up in the mountains, and in order to power Alcan, they created the Kamano Dam just outside Kitimat, and that dam flooded an entire valley where Wet'suwet'en and other people were living, and they gave them days to get out of there. And because they created that lake to power Alcan, it drowned the entire caribou population that went through there. And so
my relatives that, they were sustained off caribou for generations, they no longer get to taste that. They no longer get to show their young ones what caribou tastes like from their own homelands. And so, looking at what is this going to do to all of the populations around there long term, it's really scary to think about, because we know the history of colonialism and industry and what it does to our culture and to our ways of life there.
Just going to add one more point, is that those are incredible insights and really important, but something that we're trying to do with Cape and Cane is, as part of the Protect Health from LNG.ca campaign, we actually bought ad space up in Northwest BC and Northeast BC, in Vancouver, in Victoria. So it was running on buses. I think Ankur said he saw one of our buses, actually. This was in October. We bought this ad space. They still haven't taken the ad off the side of the bus. I guess there's a not high turnover. So we've really gotten our money's worth. But yeah, and one other thing I want to mention is my first job out of residency was as a rural family doctor on Gitxsan and Wet'suwet'en territory. I worked in Hazelton. I was chief of staff there. So I think just being there and knowing what's at stake, and I still have friends there who feel like family. So I think it's really important to know what you're fighting for, and I mean it's something that I know, because I've worked and lived in those communities.
Right. I was going to add too that there's a northern tour that's coming up as well, and where we're going to, I'll be at the Hazelton one.
Oh, hey.
Surprise. And then also Kitimat and Terrace, Millers, one of the two? Terrace. So the local community there will get to know this knowledge as well.
Yeah, so we're very happy to be organizing the same events in the last week of May in Terrace, Hazelton, and Kitimat. Not in that order, but yeah. So if you know anybody in those communities, please let them know that this community forum is going to be happening in northern BC as well. Who has a question? Okay.
I have a question. I'm from Island in at Custom House Sound. I want to follow up on your mentioning of the coercion, the level of coercion that happened. Can we expect this level of coercion also to have happened for the Squamish Nation?
So to repeat the question, can we expect, acknowledging the level of coercion that your nations experienced, can we expect that same level of coercion to have occurred for Squamish Nation?
Yeah, I would assume so. And we were talking with Jackie, who had welcomed us while we were in Squamish, and she's just seen lots of this happening in her nation as well, because we've just been put in a lot of impossible situations. Like I said, we're so forced into poverty, forced away from a way of life. Lots of our people have experienced immense trauma from residential schools and from just the history of colonialism. And it looks like a pathway out. And we all are always talking about not wanting to blame our people for finding a pathway for them to get out of poverty and to protect their families. And also we recognize that it is from coercion, and it is from, even if it's not just a company coming in and saying, we'll give you this money if you sign on, it's the felt experience of being a Native person in North America is that we have been just completely colonized. And, for us, people that fight back against that, we face a lot of adversity because of it. And so even for me, I was arrested on the front lines. I spent just 4 years in court as a young Native person. And what that signals to other Native people that want to fight back is that we have to face intense adversity and violence at the hands of the state and the hands of police and criminalization. And that's really intense to see. And I feel like I always want to couple talking about that intensity with talking about the beauty of being involved in those movements. And I actively make that choice to do it always. And I don't blame the people that don't take it on, because it's really hard, it's really difficult to face that. But I have been on blockades where no one has access unless the chiefs let them have access, and that to me is what a piece of liberation feels like. It's a piece of freedom, and I get to fight for that every day because I know what it feels like. And so in talking to our communities and, like talking with the youth, I can see that there's a lot of hope that that's possible. And so I think the work that we do as firekeepers is just really trying to stoke that flame inside of people and really, see that it's worth fighting for and that you don't have to choose the route of, getting the money from these companies when they're trying to coerce us.
Yeah, I just want to add to that is we heard from Jackie a couple days ago in Squamish about the deals that were made by the council, and that being like a very common experience. And so we live in this gray area. Shay and I we live in a gray area in which our communities are industry communities. Our chiefs have signed on to pipelines within our families. People have very different views. So we live with the complexity of that, but we stay in that discomfort. We refuse to make this a black and white issue, and we refuse to villainize our own people, and we refuse to, even yesterday or 2 days ago, sitting in court with one of my chiefs in front of me who's got billions of dollars from this pipeline, and I refuse to demonize him. And I think that that's a lesson that folks can learn outside of our communities, is holding the complexity and trying to hold on to the humanity and understanding of why people make these choices. Working class people going into industry, pipeline workers, those are not our enemies. And so Shay and I talk about this all the time, we do have this muscle or resiliency to hold what is messy and ugly and uncomfortable and continue to see the human in each other and advocate for that. So I think that's, part of the beauty too, is we refuse to let go of that, and our families have refused to let go of that over all the adversity they've faced every generation. And I think that's an underrepresented quality that we have. And so, I just wanted to mention that.
Yeah, I just want to honor that quality because it's something that needs to be transmitted everywhere. It's very difficult, I think, for privileged people to understand what it's like on the front line. And I do want to take this opportunity to point out that not everyone is going to go to jail. Not everyone has the privilege of going to jail. Maybe we should all be going to jail, but there is a whole spectrum of opportunity for action. And going to jail is one of them. But I just want to point out that there is money behind all of these projects. And probably everyone in this room has a bank that they use. And that bank is the source of money for these projects. Unless you're banking at Van City, you're probably supporting fossil energy. I would also note that your pension plans are also probably supporting fossil energy. And it's very important to keep the pressure on these boards that are supervising banks and supervising pension plans, because if we were able to cut off the money, we would be able to move the transition that we need, and we would be respecting Indigenous peoples instead of running over your lands and stealing them back again and again.
And I would just add to that, our taxes are also being used to prop up these fossil fuel companies that are mostly foreign owned and are not economically viable without that financial support. Why are our governments giving our money to these foreign-owned fossil fuel companies and then telling us that we don't have money for healthcare? Sorry. We don't have money for education? Sorry. It's not acceptable. Another question, please. I think we've got two more.
Hi, my name is Colette. I'm from Colorado. I'm a UBC student. I work up in Gitxsan territory in the summers. And I'm super stoked about the ability to go to court with these issues. And that's something hopefully we're looking forward to, and that's going to happen. But other than just buying time, what are the goals around that happening?
Yeah, actually, Gina and I, when we were on our way back to Lekwungen territory from Squamish the other day, we stopped in because SWCC, the Skeena Watershed Conservation Coalition, and the Kispiox Valley Community Association, as well as Wilps Lukwadziwas, Gina's house, is taking PRGT to court right now about the substantial start decision. Taking BC to court, sorry. About the substantial start decision that enabled PRGT to continue with his project certificate. And yeah, I got to chat with my cousin a bit, and basically part of it, PRGT right now doesn't have a final investment, and that's really major because it means that there's still hope for us to turn this around. And if it can be proved unviable, then ideally PRGT never gets a final investment, which means that they can't start construction, they can't destroy the homelands, they can't ruin the salmon population, all of these different things. And so I was talking to my cousin Jesse about it, we left from Gabu, and he was just saying, like, as long as these people are tied up in court, it feels like unlikely that they will get that investment because it seems like a risky investment to foreign investors. And so as we proved, like on Wet'suwet'en territory, even though that pipeline went through, it cost billions and billions of dollars more than it was meant to, and it took years and years longer. And there was not only local outrage about it, but outrage across like Canada and around the world. And so I feel like in situations like that where we have a chance to stop the final investment and the funding from coming in, then it proves like really successful, you know, to have that as an opportunity. And I remember like a few years ago in Vancouver, there were these people called the Braided Warriors, briefly, and they were super rad, and they were going to the insurers of the Trans Mountain pipelines and like having big rallies in their offices in Vancouver and really just like, you know, bringing it to their front doors. Because like when we're up north, it's so far away, it's really hard sometimes to get that word out. But when you're in the city centers, people really like had the right idea of like going to those places. And yeah, so I feel like even like Gina and I being at the Ledge, like that was major to be somewhere where like the legislators are sitting. It's not just some like random place thousands of kilometers away. It actually came to their front door. And I was laughing at the picture of all the nurses in front of the Ledge the other day because they, after we occupied it, they had to build another gate. But yeah, so I feel like bringing it to court and having it be down here in the city centers and like, you know, raising awareness in like more populated areas can be really beneficial.
I think this just underscores the point that I was trying to make earlier, that there are so many kinds of action that can be taken, and each of them is effective in its own way, but together they will gum up the system and make it impossible for an investor to say, oh, that's safe, yeah, we're going to build a floating LNG terminal in the straits off of Nass River and think that this is going to go through? No, it's not.
I think. Hello. Like in one of the slides, it's talking about like, from I think Louisiana. Someone said like, get ahead as far as you can before it gets started. And I think that that's like, yeah, what we learned from CGL, and this is like what we're doing, like with the court cases, like doing every single thing we can to like get on record that like we are not accepting this project. And like the more you can do, diversity of tactics, like the more pressure you put on now is like, it's so important because once they get their, you know, shovels in the ground, it's a lot harder. So like, yeah, these wraparound tactics are super important.
So just one last reminder to please complete the survey. We're asking for this to be completed specifically so that we can document public concerns, lived experience, and policy priorities, and that will help us advocate with the colonial governments. I'd like to take a moment to thank all of our incredible expert speakers who have literally traveled from across BC to be here with all of you tonight. And thank you to everybody that has joined us to listen and to learn. It is a joy to see so many people in the crowd and to have you all here with us tonight. I'd like to thank our partner organizations, the Canadian Association of Physicians for the Environment, Canadian Association of Nurses for the Environment, and the Acute Firekeepers. We could not have put on this event without all of us working together to make this happen. So we're very excited to have this series of 5 events across BC happening in the next few weeks. I'd also like to acknowledge the support from some other partner organizations, Stand.Earth, Dogwood, Wilderness Committee, the New West Climate Action Hub, and many other organizations that have helped to support the event this evening, with the volunteers that have come out to help make this all possible. We have had an incredible volunteer team this evening, so please join me in giving a round of applause to everybody. And as you are leaving, I really ask you to consider the calls to action that you've heard tonight. Sign a petition, send a letter, consider opening your wallet to support the incredible work that is being done by all of these organizations. Sign up to volunteer. There's so many different ways that we can work together to try to shift the narrative and to make change happen. It really is people power coming together and telling these stories, listening to these stories, and then taking action together that is going to make that difference.